This is the introduction to basic and applied human anatomy and development. And as you can see from the terms, I've got basic and applied. When you are learning anatomy, you have got first the basic part. You are going to be talking about cells, tissue. But besides you learning a cell and the tissue, you need to apply. How does that become relevant in the clinic, in the hospital? Besides that, there is also the development. So I'm going to also do the embryology. All right. So I'm going to describe this as we get to break down the course. So anatomy comes from the word anatom. Ana, that's meaning upon or on, and then tom is to cut. So that's why it is a bit hard for you to study anatomy minus cutting. Unfortunately, for here, it's only the medical students. So second year medical students, you'll be dealing with dead bodies which have already been cut. If you've never seen intestines before, you'll be able to see them. If you've never seen the heart, the liver, you'll be able to see the real ones. For the nursing students in second year, you'll mostly be on the ward. For pharmacy students and the biomed, you would not be anywhere, you'll just be learning in class. It's next year that you start doing some of those things, attachments and other things. So, anatomy is a branch of biology and medicine, and in anatomy, we are interested in structures because we have got three many basic sciences: anatomy, physiology, and biochemistry. Anatomy, let's say for example, I'm talking about the heart. Anatomy, I'm interested in looking at the structure of the heart. And of course, mentioning the function that the heart does. Okay, the heart pumps blood. Physiology is going to come in and answer how. If the heart pumps blood, how does it pump blood? Or I can give something that is easy. Let's say, for example, we're talking about the kidney. For anatomy, I'm going to talk about the parts that make up the kidney, the nephron, the loops of Henle. Then, the nephron has got all these parts, the ascending loops. You have got the distal convoluted tubules, the proximal, and we are going to say that, okay, in anatomy, we just say these are the parts of the kidney, and the kidney is used to make urine and to maintain a blood pressure. Physiology is going to come in and say, how do you maintain blood pressure as a kidney? How do you make urine as a kidney? Now you start breaking down the mechanisms. So that's the difference between physiology and anatomy. Anatomy, I'm most interested in parts. Biochemistry will now be going into the cellular level, like what is happening at the cellular level, because every living thing is made up of cells. So you go to the cellular level of what is happening there, right? So anatomy should be regarded as a firm foundation of the whole art of medicine and is very essential. Is the very essential beginning when you want to understand medicine. Of course, when we're saying medicine, we don't mean just doctors. It's not only doctors who are studying medicine. So that statement was mentioned by Andreas Vesalius in his book, which is known as The Human Corporis Fabrica Libri Septem, which was written in 1543. So for medicine, they can bring this question as simple as this: who wrote the book De Human Corporis Fabrica Libri Septem, in which year? Or they can ask you the name and the book, what book was written. So that's for medicine specifically. Now, human anatomy is divided into three parts. You have got gross anatomy, histology, and embryology. The gross anatomy we are talking about, gross means something that is big. So when you're talking about gross anatomy, this is what you can see with your eyes. Okay, you can see with your eyes. That's gross anatomy. And histology, histo means tissue. Of course, logy, that's study. So histology is the study of tissue. Now, let's say in gross anatomy, I'm going to get a muscle. So what I can see my biceps muscle, my triceps. That's gross. Now, histology is if I get a muscle, I put it on the microscope, what am I going to be able to see? That's what we're interested in histology. Embryology, I'm interested in understanding how does a muscle come about when I'm in my mother's womb. How were muscles formed? From where did they come from? Okay. So gross anatomy is the macroscopic anatomy. You are looking at something with your naked eyes. For example, you can see you've been shown body parts here. In histology, it is you using a microscope to study tissue of the body. Now, the entire histology, you have got actually the entire human body, even if the human body has got a lot of cells, you only have four types of tissue. You have got epithelial tissue, you have got connective tissue, you have got muscle tissue, and you have got nervous tissue. These are the only four types of tissue. So all the cells that you can talk about in the body, you can group them because you know that a group of cells put together will make up a tissue. Any one of these four types, epithelium, connective tissue, muscle, or nervous. And then different types of tissue put together will form an organ. A lot of organs put together will form a system, like a reproductive system. A lot of systems put together will form the organism. Actually, the way we'll be learning anatomy is that we are going to split them into components. So, in today's discussion, we are discussing gross anatomy. The next discussion will discuss histology. The other discussion will talk about embryology, and then we'll come back to gross. We'll do that's how we are going to be moving. We just don't learn anyhow, right? So that is how it goes about. So in histology, what you are going to be doing is you are going to get a part of the body, you take a section of the body. You can see that section, you are going to fix it like you are keeping it. Actually, we'll discuss all these processes in the first topic in histology because this is gross anatomy. As I wanted to show you the basic component. Embryology is developmental anatomy. You are interested what happens first of all. Uh, what happens? How do you form the sperm? That is how we are going to start. How do you form a sperm? How do you form the egg? If you know how you form a sperm and how you form the egg, and then now the next thing we'll discuss is if the sperm and the egg come together, how are you going to form a zygote? So we'll start now discussing when you have formed the zygote, what will happen to the zygote on day one, what will happen to it on day 2, day 3, day 4, day 5, day 6, day 7. When you move from days, we'll now go to weeks. What happens in week 1, week 2, week 3, week 4, week 5, just like that. When we move from weeks, we'll go to months. What happens in the first month, the second month, the third month? After we move from that, we'll now start talking, okay, when development is happening, what are some problems that can go wrong? How is it that some people are born without a mouth? How is it that some people are born and then their intestines are outside while someone has got intestines inside? So when you're discussing embryology, you are always supposed to know what can go wrong as you discuss embryology. And what can go wrong is known as the teratology. All right, these are congenital disorders, the things that can go wrong during development. So this is how we are going to be able to discuss embryology. Now back to our gross anatomy. That was the intro overview about anatomy. So how do you study gross anatomy? Now, as we said, anatomy means to cut or to dissect. So meaning that it is very hard for you to study anatomy minus seeing. You see, you can be very good at theory, but if you'll not be dealing with theory, you'll be dealing with real human beings. So that's why you need to know the actual body part, because sometimes we'll be discussing muscles, and the problem is that in the body I can have a muscle that you don't have. There are some muscles that are not in everyone. That is why you need to know the actual body, not just the theory part. So the way you can study anatomy is you can use cadavers. A cadaver is a body that died and has been preserved so that you can use it for studying. Now you have got prosected cadavers, you have got plastinated cadavers, you have got also plastic models. These are the ones that you used to see in high school. Okay, so when you're talking about the main way in which you study gross anatomy is dissection. To dissect means to cut a cadaver. A cadaver is a body that is dead and that it has been preserved. So you don't say dead body, you say cadaver, right? And we also have what we call autopsy or postmortem. Postmortem is cutting a dead body to find out what caused death. Dissection is cutting the dead body, that is a cadaver, in order to learn. That's to dissect. But dissection can be used generally. Any cutting in medicine will say is to dissect. Okay, we are going to dissect this part of your body. So that's just means to cut. Now, cadavers, you can use a prosected cadaver when you want to study gross anatomy. This is a previously dissected cadaver, like you already have a cadaver or a dead body that was already cut, all right, and then it has now been preserved for students just to come and view. So for medical students, you'll be doing this when you open. You'll be This is what you'll be doing. You go and see the body parts. You go and look at the bones, the humerus, the femur. You look at all the different parts that are there, and then this. So basically that's what you're going to be doing. That's a prosected cadaver, a cadaver that has already been cut. And the way you preserve this body part so that you can study the entire year or even more is because you use a preservative, and that preservative that you use is formalin. That is why dead bodies have got a certain smell. It's not actually the way they smell, but it's because of the preservative used for embalming dead bodies. That's known as formalin. And the formalin is very bad. Sometimes you always have flu, because when you go in the dissection room, which we call DR, you always be dealing with these, and so it will be a bit of painful. But it's an interesting journey. You can also use a plastinated cadaver. The Here you are preserving tissue using synthetic materials like silicone. Okay, so this is a body part that has been preserved. You can also use plastic models. This is not a real human being, but it's just a model to represent the parts that you're able to see. So how can gross anatomy be studied then? How can we really study gross anatomy? You can study gross anatomy using regions or systems. Okay? And for UNZA, we use regions. For some schools like CBU, they'll use systems. Like you study the digestive system. If you are cutting, you study that system. If you are doing that, but for UNZA, we'll be doing with regions. So on the regions, you have got the head and neck, and head and neck for medical students, you'll be cutting this in third year, not second year. But at second, you're supposed to understand the trunk, the extremities. Now, for other programs like pharmacy, biomed, you are going to cover all this in second year, except that it is going to be shallow. You don't go as much detailed as the medical students will be going. So you look at the trunk. The trunk is the thoracic, the part which contains the heart, the abdomen, where the intestines, the pelvic, where you find the part of the GIT, the gastrointestinal tract, and the reproductive system. The perineum also, that is also where you are going to have the reproductive organs, and then you study also the back. You also have the extremities, which are the limbs, upper limb and lower limb. This is how you study when it comes to the regional study. And then the systemic approaches, where looking at all the systems in the body. So I've got 11 systems: the nervous system, skeletal system, muscular system, the GIT, respiratory system, the endocrine system, integumentary system. This is what I talk about the skin and the parts that which we call the skin appendages, like the hair, the nails, those urinary system, cardiovascular system, lymphatic system, and the reproductive system. So sometimes we can say we have got 10 systems because we combine the skeletal system and the muscular system. We call it the musculoskeletal system. In that case, we're going to say we have got 10 systems, right? So the way we're going to be doing anatomy, when we start learning histology, we'll start by looking at a cell. After we are done looking at a cell, we'll go to looking at tissue. After we look at all the four types of tissue, now looking at the systems, and then that's how anatomy is going to be done. But for you to finish that, it's a lot, right? It's a lot. So again, of importance, the main aim of this class is for you to understand what we call the body positions. That is the main aim of this class, body positions. So when you look at a body, let's say for example, someone went to have to undergo a surgery, but then it is me as a doctor who knows which part has got a problem, right? Let's say it's their right hand, and there is a specific region, a specific part where I want them to be cut, but I'm not there to perform a surgery. I just write down where they're supposed to be cut. How is the doctor that is in USA or the doctor that is in South Africa going to know that this is the actual part that is supposed to be cut? Because if you make a mistake, you're supposed to cut the right hand. Let's say, for example, you made the mistake, they cut the left hand. You say, "No, I meant the right." Someone has lost a body part. That's a problem. You can be sued, right? So that's why you need to know the language of anatomy. And this language of anatomy is consistent in the medical sphere. Everyone in the medical system knows this language. So the first thing that every medical person should know is the anatomical position. The anatomical position is the standard and the reference position of the body, and it is used to describe the location of structures. You can see this person here. This is what we call the anatomical position. You are standing up straight. Okay, look at the palms. The palms are facing forward. The palm is the part of the hand that you use for touching, like when you're eating your food. These are facing forward. And can you see the legs are not far apart? And your face, look at the face. The face is not looking down. Neither are you looking up. It's like you are looking at something that is a bit afar off. And again, you are not smiling. All right. So this is known as the anatomical position. They can give even some MCQs there. So the anatomical position is when the body is standing upright, the feet are together, the hands are on the side, the face is looking forward, the mouth is closed, facial expression is neutral, not smiling, the rim of the bone under the eyes is the same horizontal plane as the top of the opening. I'm going to show you that the eyes are open and focused on something in a distant place, and then the toes point forward. The palms of the hand face forward with the fingers straight and together, and with the pads of the thumb and turned. The pads of the thumb turn 90 degrees to the pads of the fingers, like here. The the thumb and the fingers is making 90 degrees. The one I said that the rim of the bone, the rim of bone under the eyes is in the same horizontal plane as the top of the opening of the ear. It's this one that you can see here. Okay, this line that has been drawn. So that, my friends, is known as the anatomical position. So if they ask you to describe the anatomical position, it is as simple as this. If you can just remember a person who is like this, please, their palms are not facing behind, right? They're facing in front. You have got other positions. For example, I've got the supine position. Supine position is where someone is lying. Just think of spine, right? Your spinal cord is behind, isn't it? So you are lying out on your back, and your palms are facing upwards. Not like this person here. You can see this person, the palms are facing downwards. So the palms are supposed to be facing upward. It's like the same way you are in an anatomical position, but then you are sleeping. Okay. You also have what we call the prone position. The prone position is the opposite, where you are now looking downwards. It's different from, is the opposite of the supine position. You also have what we call the lithotomy position. This is the position that women are going to be in when they are giving birth. Yes, please. Is that a question? Yes, Nat? It's not visible enough. Okay. Let me just make it visible again. Is it visible now? Okay, thank you so much. All right, so this is a lithotomy position, a position in which a person is going to be when they are giving birth. So after understanding the positions, we now have to understand what we call the planes of the body. The body planes, these are imaginary lines, okay? And you have got three major groups of planes. You need to know them. We have got what we call the coronal plane or the frontal plane, the sagittal plane, and the transverse or horizontal or axial plane. Look at this. These are imaginary lines that we can use to separate the body so that you can be able to describe the body properly. If you cut a body like into up and down, we call that as a transverse plane. Transverse is horizontal. So the other term for transverse is horizontal line. Horizontal plane. It's also known as the axial plane. So maybe in an MCQ, any one of those three terms means the same. And then the frontal plane. Okay, let me start with the sagittal. The sagittal plane is the one that runs on your middle, like separating you into left and right. Equal parts. Equal parts. You have got the left part and the right part. Equal. That's the sagittal plane. Now, if you get this sagittal plane, you move it a bit. Okay, you are going to have what we call the mid sagittal. So the mid sagittal plane is the specific sagittal plane through the midline of the body. That's the mid sagittal. And then I've got what we call the parasagittal plane. This is when you get the sagittal plane or the mid sagittal plane, you just move it in any direction, either on the left or on the right. That becomes the parasagittal. For example, can you see this line that is in yellow? This is the parasagittal plane because it's not passing through the middle of the body, but it's parallel to the sagittal plane. That's parasagittal. The frontal plane is also known as the coronal plane. This one separates you into front and back. Like it's passing through the top of your head and then also cutting like your hand into half, also your leg into half, separating you into front and back. That's a frontal plane. Okay. So the transverse plane will divide you into up and down. For now, I'm using the word up and down, but you are going to know what terms we use in anatomy. And then the frontal plane is dividing you into front and back. Again, I'm using front and back, but we don't use those terms in anatomy. The sagittal plane is dividing you into left and right. Is there any question? Any question? Okay. So now we need to understand the terms that are used to describe location now that we know the planes. So when we use the coronal plane or the frontal plane, we say that that plane was able to divide us into front and back. Now front, anatomically, we say anterior. The other term for anterior is ventral. Back, we say posterior or dorsal. So the opposite for posterior is anterior. The opposite for dorsal is ventral. Those are the anatomical terms. For example, if you are comparing, look at the ears and look at the nose, right? So we will say that the nose is anterior to the ears. That is meaning that the nose is in front of the ears. Or we'll say, look at the breasts and the buttocks. We'll say the buttocks are dorsal to the breasts. They are at the back, or they are posterior to the breasts. Okay, so that is how you used to describe that. And we also talked about the sagittal plane. Remember, the sagittal plane divided us into left and right. Any structure or body part that is near the sagittal plane, we will say that it is medial. Okay, and then not middle but medial. The one that is very much away from the sagittal plane, we say is lateral. For example, compare the breast and the arm. We'll say the arm is lateral to the breast because it is far away from the midline in comparison to the breast. If you compare the eye and the nose is medial to the eyes. The meaning of that is that the nose is more closer to the midline in comparison to the eyes. Again, if you are describing, let's say, the thumb and the little finger is this kind of pink finger, this one. So we'll say the thumb is lateral to the finger. And we are describing that because it's in an atomical position. In an atomical position, the thumb is always supposed to be lateral to the pink finger, or the pink finger should be medial, the most medial in comparison to the other fingers. Does this make sense? I need a response from people so that I see how we are moving. Are we getting there together? Okay, be able to ask if you're not getting it, because if you don't ask, you remain. Okay. And then remember we said that we have got the coronal plane. Oh, sorry, not the coronal, but the horizontal plane, also known as the axial plane, that divides us into up and down. Now, up we use the word superior, down we use the word inferior. So, for example, we are going to say, you can see this is the knee, right? The knee is inferior to the shoulder. Or we can say the head is superior to the breast. The head is on top. Or the head is superior to the shoulder. We also have the terms cranial and caudal. Caudal means towards the tail, and the tail in this case we are referring to downwards. And then cranial means towards the head. Cranium means the head, right? The head. So cranial can also be used to mean superior, and then caudal to mean inferior. And then, if you are talking about those body parts that have got a beginning, the beginning in anatomy we call it the origin. For example, if you look at the limbs, the upper limb, so the upper limb, this is not a hand, please. Now that you guys are learning anatomy, the hand is only this part that you are going to be using for touching, and like this part. And this is going to be the arm, and then this is going to be the forearm. Okay, forearm, arm, and the hand down. Just like this, the entire of this is not a leg. You have got the thigh, you have got the leg, and then you have got the foot. So please, you are learning anatomy, make sure that you use the right term. So for example, can you see that the arm, the forearm, is on top, right? Here, and then the arm is here. So when you are comparing the parts of the body that have got a beginning, in this case, the beginning of the limb is going to, for example, the upper limb is going to be the shoulder joint. So the structures that are at the end here, for example, the fingers, we say they are distal, they are far. And then the ones that are near the beginning of the near the shoulder, we say they are proximal. For example, we're going to say the hand is distal to the elbow. The elbow is this part, the middle here. And then the hand is the end here. So the hand is distal to the elbow because the elbow is near to the beginning. Or we can say the glenohumeral joint is proximal to the elbow. Glenohumeral joint is this shoulder joint. We name it glenohumeral joint because of the bones that are articulating. We are going to understand later on when we start discussing about the bones. Okay, so the shoulder joint is proximal to the elbow. So that's how you use these terms. The terms can also be used to describe the relative position of branches along the course of a linear structure. For example, if you have got a blood vessel, right? A blood vessel is linear. So that part of the blood vessel, let's say, for example, if you're talking about the heart, that is near to the heart, we are going to say that it is proximal. And then that part of the blood vessel that is very far away from the heart, we'll say that is the distal. We can also use the term rostral, but specifically to refer to the head, to mean structures that are near to the nose. That's the meaning of rostral. And then you can also talk about superficial and deep. For structures that are more inside, we call those as deep structures. Those that are near the surface, we call them superficial. For example, I can compare my stomach and the skin. So the skin is superficial to the stomach because the stomach is inside. Or we'll say the stomach is deep to the skin. You can also talk, let's say, for example, the sternum and the heart. The sternum is, you can even touch yourself, like on your middle, where you say, okay, my heart is here, but the very middle. That bone that you feel on the very middle is the sternum. And then the heart is inside. So the sternum is superficial to the heart, while the stomach is deep to the abdominal wall. The abdominal wall is just if you touch your abdomen right now or your belly, what you are touching will be the muscles. That's known as the abdominal wall. So the stomach is deep to that. Other terms you need to understand is what we call unilateral and bilateral. So this refers to structures that are found on one side or both sides. For example, bilateral means a structure that is found on both sides of the body. For example, the kidney is found on the left and on the right. The lungs are found on the left and on the right. A unilateral structure is only found on one part of the body, like the heart. The heart is only found on one part, it's actually more on the left. The spleen is only found on the left. The appendix is only found on the right. So these are unilateral structures. You don't find them both sides. But someone can have a condition where the heart changes direction. Instead of being more on the left, it's also more on the right. That's known as dextrocardia. You also have the terms ipsilateral and contralateral. If you are talking about ipsilateral, you are talking about body parts that are found on the same side. For example, you can see the left arm and the left leg, these guys are ipsilateral, they're on the same side. The left arm and the right arm or right leg, these are on the opposite side. So we say they are contralateral. Okay? They are contralateral. Contralateral means opposite. Ipsilateral means on the same side of the body. We also have the term which we call invagination and evagination. Invagination, it's inside. So this will talk about body parts that go inside. And then evagination means to come outside. Okay. When you're talking about the hand or the foot, this part of the hand that we use for eating, that's known as the palm. And then the other part of the hand, the other side, which we don't use for eating, that's known as the dorsum. The dorsum. Palmar surface and then the dorsal surface. For the foot, the part that we use for stepping is known as the plantar, not palmar, plantar. But the top part is still known as the dorsum. So the reason as to why we are different on the feet and on the hand is because of development in embryology. What happens is that actually as we are developing, the limbs are going to turn. They are going to turn. That's why when you are bending your hands bend. So let me use now anatomical language. When you are bending arm, your arm is going to bend forward. But when you want to bend your leg bends behind, right? That's because when development was happening, your legs had to turn. That's why they are a bit opposite. Please take note the down part of the leg, that's known as the plantar, while the top is the dorsum. And then the part of the hand used for touching, that's the palmar, while the other side is the dorsum, just like the feet. Is that okay? Okay, good. So you can actually combine these terms, these are anatomical terms that we've described. For example, look at this. Let's talk about the nose and the ear. You can see the nose in front is in front of the ear. So say that the nose is anterior to the ear. Anterior, remember, means in front. So the nose is anterior to the ear. But at the same time, can you see that the nose is more close to the midline in comparison to the ear? So we say the nose is medial to the ear. So I've got the nose is anterior to the ear, the nose is medial to the ear. So we combine those two terms. So I'm going to say that the nose is anteromedial to the ear. Anteromedial. It is in front and more on the medial aspect. It's close to the midline. That's how you combine those terms. I've put some few terms here that you can use to combine. For example, the chin. You know the chin? The chin is inferomedial to the external ear. The ear is more outside. And then the chin is closer to the midline, but at the same time is down. Okay, it is inferior in comparison to the ear because the ear is on top, the chin is down. So the chin is inferior to the ear. At the same time, it is medial to the ear, so it is inferomedial. So instead of saying inferior, remove those last words and put o, inferomedial. Just like the shoulder and the belly button. You know the belly button. This, which one is the belly button? How do I even describe it? Where there was the umbilical cord. So the shoulder, you know that it is on top to the belly button. So say the shoulder is superior to the belly button. At the same time, the shoulder, the belly button is more close to the middle than the shoulder. So the shoulder is lateral to the belly button. So we can say the shoulder joint is superolateral. It is on top and then away from the middle in comparison to the belly button. So you can try out 3 and 4. The pinna of the ear is dash to the eye. The stomach is dash to the skin. Okay, this one is easy. The stomach is deep to the skin. But how about the pinna of the ear? The pinna of the ear is this part, this soft part of the ear. What term can you describe in relation to the eye? I want you to try this question. You should send to me. And then lastly, when you're talking about anatomy, it's about the anatomical terms to describe movement. Movement. So I've got a flexion and extension. So to flex means to bend, okay, or to reduce the angle. For example, you can see here, if you take your arm towards more like your chest, not really your chest, but towards your shoulder joint, that is flexion. If you want to straighten your arm, straightening or increasing the angle, that is extension. But when you're talking about the leg, to be specific, you are going to have what we call dorsiflexion and plantar flexion. Look at this. Hope you can see this one here. When you are flexing, like when you are bending towards, okay, towards the dorsum, that's known as dorsiflexion. Then when you are bending towards the plantar surface, that's known as plantar flexion. So there is no plantar extension. There's just the dorsiflexion and plantar flexion. You can see again, if you are turning forward like this, that's flexion. You are bending, you are reducing this angle here. But if you are turning backward like that, that's extension. You are straightening yourself. When you move in the side, that is known as lateral flexion. You are still bending, right? To flex is to bend, but you are doing it on the lateral aspect, on your side. That's lateral flexion of the trunk. You have got the terms known as abduction and adduction. To adduction, just think of add, is to bring together. So for example, you brought together your fingers, that's adduction. But when you take the fingers away from each other, that's abduction. Okay, abduction. Same way with your feet. You can see this comma second toe here. If you take other toes away from this second one, that's abduction. But if you take the others towards this second one, that's going to be adduction. Just like for the hand, be referring to this to this digit here, the big one. If you move these others towards this big one, that's going to be adduction. Away is abduction. Same, if you get the entire of your limb, like the entire limb, you bring it near your trunk. Your trunk is this part of the body that holds the hands, the legs. So bringing near the trunk, that is adduction. Away from the trunk, that's abduction. Same with the leg. Adduction, you are trying to bring near the midline. Abduction, away from the midline. If you combine these terms now, you form what we call, if you combine flexion, abduction, extension, and adduction, you form what we call circumduction. So circumduction is flexion, abduction, extension, adduction. So circumduction is you like rounding, forming a circle with your hand. You can try it. You can try to form a circle with your hand like that. Like you are moving forward, up, down, up, down like that. That's circumduction. You should know the order. Okay, flexion, abduction, extension, adduction. But you can also move in the opposite direction. You can start with extension, you go to abduction, you go to flexion, and then you go to adduction. In other words, anywhere where you start, as long as you follow this order, flexion, abduction, extension, adduction. I try to write something here so that you can help you remember. Fabi, like a baby, baby. So Fabi there, the flexion, abduction, extension, adduction. If you turn the arrow into the opposite direction, it will still be correct. That will still be circumduction. And then you also have what we call the medial or internal rotation and external rotation. You can see this arm here, the way it is. If you try to move your arm away from your body like that, that's lateral rotation. This is rotation, it's not actual movement. And if you try to move it towards your body, okay, towards your trunk, that is going to be medial rotation or internal rotation. Or just even your leg, like if you try to, you can see you move your foot away like that, away from the midline, that's it, lateral rotation. Towards the midline, that's medial rotation. You also have what we call supination and pronation. Supination is the way you do your hand when you're trying to ask for food. Pronation is think of if you are beating like the basketball, you are hitting it. So that's pronation. And take note that when the hand is pronated, you have got these bones, you have got the ulna and the radius. How do you know which one is which? The radius is the one that is near the thumb. So when you pronate your hand, the radius is going to be over or on top of the ulna. Take note of that. During pronation, the radius is on top of the ulna. And then there's also what we call opposition and reposition. To oppose means like you are putting the fingers, the digits close to each other. And then opposing means when the tip of the thumb touches the tip of any of the fingers, that's opposition. And then if you remove them, that's reposition. You also have inversion and eversion. Look at the way the feet is. Inversion means you are taking your foot like towards the midline. The down part of your foot, which is the plantar, should be facing the medial aspect. That's inversion. Eversion is you trying to now take the plantar to face away from the midline. That's eversion. And then the last two terms we are talking about, protraction. To protract means to slide forward. For example, the jaw. You can see this guy here is trying to protrude the jaw. That's protraction. And then to retract means to bring back. That will be the same with taking your shoulders forward, that's protraction, and then bringing them back, that's retraction. And then the last term is elevation and depression. To elevate means to take up. To depress means to take down. So for example, you can see this one as elevated the shoulders, this one as depressed the shoulders. So of course you have to go through this again so that you can just get to make sure that these things are stuck in your head. You look at these questions if you can answer, and you can send to my inbox for me to confirm if you answer. We see if what you've done is correct. These are exam questions. That is where we end for now. Thank you so much.